I will start out with my 6 medication rights, which is right patient, right drug, right dose, right time, right route, and right documentation. I will check my MAR to see what the Dr. It will pincha, my MAR, and who my patient is. My patient is IV needed. She is admitted for rehydration and antibiotic therapy. I will initiate a 1,000 milliliter, 0.9% normal saline to infuse over 6 hours. This will give me a 167 milliliters per hour. It will give me a drop factor of 2.8 milliliters per minute. And with the tubing that has 10 drops per milliliter, it will give me 28 drops per minute. Okay. I will, when I come into the patient's room, I will identify them using 2 identifiers. There is no there is no birth date on my order, so I'm pretending. So, hi, my name is Kristen. I am going to be your nurse today. Can you please verify your name and date of birth? They say my name is IV needed, which matches, and my date of birth is March 12th, 1978, I'm guessing. Okay, that matches too. Okay, I will explain to her why I am going to start an IV fluid, that she's dehydrated and that we need to start giving her fluids via IV. All right, I will move also the bed into a, I'll make sure she's comfortable and then move it into a nice working height. Next, I will take my medication label and I will start labeling for my saline bag. So this is IV needed, room number 12. Drug is 0.9% normal saline. Amount is 1,000 milliliters, added by CB. There is no base solution. Today's date is 3/28/21. It is 250. So that would be 1450. Flow rate is 167 milliliters per hour. Expiration date on my IV solution is November of 21. And start time, yep, I think that's it. All right, next I will get my tubing out. Let's see here. I always have a hard time with this. Get my tubing out. One of these days I'll figure out an easy way to open this. I will remove my tubing. Make sure the roller clamp is locked. I will also label my tubing with the date 3/28/21, the time 14:53, and my initials. All right, I'm going to get my trash somewhere. My IV solution off. Make sure it's what it says. I'm going to put my medication label on it. let's see here. This is so much tubing. Let's move up my, oh, that's fine, okay. Locked, that's locked, okay. I will pull off the little blue tab, undo my spike, and push it in there. Okay. Once I've spiked my bag, I will hang my IV fluid up on my IV pole. Okay. I will, can you see? Yep. I will squish in my drip chamber to get water at about halfway full. Okay, let's see here. All right, let's get this a little straight. I'm still here. I will slowly release some and prime the tubing. Oh, there it goes. Oh, that's a little fast. Get any of the air bubbles out. Let's make sure that I'm all tangled up so that I don't know where I'm going. Okay, I see the fluid. Slowly getting that going, all primed. And I have primed my tubing. Let's get this all situated. I'm all tangled. All tangled. There we go. I will hang that until I'm ready to use it. Right here by me. All right. Now that that's ready, I am going to now prepare the patient. Okay. I'm going to move my physician's orders out of the way. I will put down a pad to underneath their arm, and I will set out all of my, I'll just put this way, set out all of my materials. Okay. What's wrong? Love you too. Go see Dada, please. All right. Next, I will tourniquet my patient's arm with my tourniquet, and I will palpate. I'll turn this down a little bit. I'll palpate for a vein, and I found a vein right here, and then I will loosen. I'm getting everything ready. I'm doing hand hygiene, and I'm putting on gloves. I have chosen, because this is what we're given, I have chosen a 20 gauge catheter. I have my lure lock. I have my 0.9% and normal saline flush. And my alcohol prep pad, which I'm running low on those. I have my Tegaderm, my clear dressing, and I have some gauze pads in place of my chevron to the stabilizer for the catheter, and my tape. I meant to do my tape before I got my gloves on. I didn't do this. I got my tape ready. So I'm going to put a little piece on my desk to give me a sort of a sterile working place, or a cleaner working place. And then I'm going to just pull out some pieces of tape so they are ready for me. Couple more pieces. Okay, that should be plenty, hopefully. Wash my hand, put my glove back on. I will prepare my gauze pads. Can't really see it, but it's there. I can move it a little bit. Okay, there. You can start to see it now. Okay. So my gauze pads are there. I am opening up my clear bandage for over the IV site. I will attach my saline flush to my saline lock, possibly. Okay, so that's prepared. All right. Okay, so I have my catheter needle, I have my alcohol prep pad. All right, so and no, my arm is not over my stuff. This is just how it's set up. I re-tourniquet the arm. I make sure I palpate. I clean with my alcohol pad. Since I'm running low on this, I'm not opening it. Clean with my alcohol pad very briskly. I'm going to open up my catheter pack. Pull off the cap. I am going to just make sure it moves easily. Okay. I will have bevel up. I will stabilize the vein. And I will insert. And I've seen flashback, so I will float just a little bit more. And then I will start releasing. There we go. The needle. And then I will press down so I don't get any blood flying. Oh, maybe. Okay. Pressing down. No blood flying into my sharps. I will take my saline lock and take that off. I will attach it. I will check patency by first pushing a little bit of fluid in. And then aspirating, pushing. I don't have a thing. And aspirating. All right. I will remove my I will use my gauze to stabilize in a V-like area. Stabilize the catheter. Somehow I don't have a chevron to stabilize. Okay. And then I will take, oh, come on, okay. And place over. It's not on the hub. It has a convenient place here to put my date, the date and initials. So date would be, I can do that in a little bit. Okay. Oh, I just did that. Okay, because I'm not thinking. All right. And then we'll take one of my pieces of tape and stabilize the gauze pad. Okay, so we can see it has a chevron, V chevron. I'm trying my best. Take that. Next, I will take my IV tubing. My IV tubing, I will remove this. I will use another alcohol pad and make sure this is clean before I put anything on it. I will remove the cap using aseptic technique, and I will insert with the lure lock. I will adjust with my roller clamp to get myself, what was it? 28 drops per minute. So as I am adjusting, I'm going, and it is 28 drops. I've looked, I've checked for 30 seconds, and I have gotten 14 drops in 30 seconds. And then I will continue to monitor. I will take my IV tubing and tape. And of course, I don't have any arm there. I would tape the IV tubing to the patient to stabilize. So that's taped. I'll just tape it like that. I'm going to use it again later. And then this, we'll do this. Okay, taped. That's taped. All right, so I have I've done the correct, it's coming down to the correct way. I have my IV going. They are to get this for 6 hours, 1,000 milliliters. Oh, it's coming out. It's not working as well as I wanted to. Anyways, it's coming, and then we're working it through, and it's going. I have cleaned them up. I am putting them back in the bed in the lower position, making sure they're in a good position. I have put the call light by them, make sure they don't need anything else, and I will come back later to check and monitor this IV solution. Make sure that the drop rates are still going, make sure everything is still functioning the way it should be. Just tape it down like that. Okay. And then I think that's it. I hope that's it. I can't. Oh yes, I did disconnect the tourniquet before I started doing all that. That was done. And that's how we do an IV. My IV is not really staying. I don't have an arm up here for it to connect to. All right, I think I've done it.